Welcome to The Explainer. Today, we're doing something a little different. We are actually cracking open a real, anonymized medical report to solve a diagnostic mystery. We're going to follow the clues, step by step, to see what a patient's own body can tell us.
So, think about it. You've got a patient with a whole bunch of confusing symptoms, and the usual treatments just aren't cutting it. How did doctors look past the surface and find out what's really going on? Well, that's the big question we're digging into today. Our story kicks off with a 57-year-old man, and his body is sending out some seriously puzzling signals. Let's take a look at the exact challenge his doctors were facing.
So, check this out. The patient had tremors, really slowed movement, even what's described as a mask-like facial expression. Now, doctors thought they knew what was up. They suspected a particular neurological condition, but the treatment just wasn't working. Then you add in these sudden muscle jerks and this weird cogwheel stiffness. It became obvious they needed to look for clues somewhere else. Sometimes a problem in one part of the body can totally mimic symptoms of something else. The investigation had to go deeper.
Yeah, it was pretty clear that just looking from the outside wasn't going to cut it. To solve this case, the medical team needed a way to see what was happening on a cellular level throughout his entire body. They needed to call in a high-tech detective.
And that brings us to our lead investigator for this mystery, the PET CT scan. So let's break down exactly how this incredible piece of technology actually works.
At its heart, a PET scan is basically a hybrid. It's brilliant, really. It takes two super powerful scanning technologies and merges them into one, giving you this amazingly detailed picture of both your body's structure and its function. The best way to think about it is like a detective team. You've got the CT scan. That's your map maker. It creates this perfect anatomical blueprint of your body, showing exactly where every single organ and bone is. But then you have the PET scan. That's the scout. Its job is to hunt for hotspots. These are areas where cells are burning through a ton of energy. That can be a sign of anything from inflammation to something more serious. So together, they tell you not just what's happening, but exactly where it's happening. It's a game changer. Now here's a term from the reports you gotta know. FDG AVID. It sounds super complicated, right? But honestly, it's simple. It just means an area is attracting the tracer. See, the tracer they use, called FDG, is basically a type of radioactive sugar. And cells that are working over time, our hotspots, they just gobble that stuff up. So finding an FDG avid spot is a major, major clue for the doctors. And the process itself? It's surprisingly simple. First, the patient gets a little injection of that radioactive sugar, the FDG. Then, they basically just get to relax for about an hour. They just lie there quietly while that tracer travels all through their body, seeking out those high-energy cells. And finally, they slide into the scanner, which takes these incredibly detailed pictures from their head all the way down to their mid-thighs, building that complete map.
All right, our detective is officially on the case. The scan is complete. And now, we get to peek over the radiologist's shoulder and follow along with the report as they search the body, region by region, hunting for those all-important FDG avid clues.
The search kicks off right at the top, the head and neck. And what's the first finding? All clear. Totally normal. No suspicious hotspots, no weird structures. So the investigation moves on.
Okay, now we're moving down into the chest, the thorax. And here we find our first clue. A few lymph nodes are lighting up, described as faintly FDG avid. So they're active, but just a little bit. The report's conclusion? It's probably just leftover from some minor, old inflammation. It's a clue, for sure, but it doesn't seem to be the answer to our big mystery. Next up, the abdomen and pelvis. Now, the CT scan, our map maker, does spot an enlarged prostate, which is a super common condition called BPH. But here's the crucial part. The PET scan, our hotspot detector, shows no significant energy use there at all. And this is a perfect example of how these two scans work together. We see a structural change, sure, but it's not metabolically active in a way that's worrisome. And the final stop on our body tour is the skeletal system. And what do you know? We find another hotspot, an area of that increased FDG uptake. This time in a hip ligament. The report flags it as probably inflammatory. So again, we've found something, but it just doesn't seem to connect back to those really puzzling neurological symptoms that started this whole thing. So, after a thorough head-to-thigh search for clues, our investigator has collected all the evidence. It is time to read the final impression, the bottom line from the radiologist. And here it is, the official conclusion, pulled right from the report.
I know, it's a mouthful of medical speak, but that phrase abnormal hypermetabolism, that's just the really technical way of saying those significant, high-energy hotspots we've been on the lookout for. So let's break down what this verdict really means.
To put it simply, the verdict is in. The PET scan found no evidence of a major, metabolically active disease anywhere in the body that could be causing these symptoms. The hunt for a high-energy smoking gun came up empty.
So what does a negative result like this actually mean? You might think it's a dead end, but it's actually incredibly valuable. For one, it rules out some of the worst-case scenarios like widespread cancer, which is a massive relief. But maybe the most important finding is what it didn't find. It tells the doctors, with a really high degree of certainty, that the answer to this puzzle isn't a metabolic one. The mystery isn't solved, no, but the investigation has just taken a critical turn, dramatically narrowing down the list of possibilities.
And that's where we have to leave this story. The PET CT scan did its job perfectly. It gave a clear, definitive answer, even if that answer was, the clues you're looking for aren't here. This forces the medical team to pivot, to look in totally new directions, but now they're armed with the powerful knowledge of what's been ruled out. It just goes to show you, sometimes the most important clue is the one you don't find.